Welcome back to Healthcare Consumerism Radio. This is Brent, Macy, Managing Director for the Institute for Healthcare Consumerism, joined with CEO and founder of the Institute, Doug Field. And joining us on this segment is PK. PK is founder and CEO of Symbiosis Health. Welcome, PK.
Hey, thank you.
Now, I know you guys, we were kind of reading through your bio and reading through what Symbiosis Health does. Kind of give our audience a good feel for Symbiosis Health.
Sure. So Symbiosis Health is a direct pay marketplace for medical services. And what we provide is, for the providers, it's a way to publish their own prices and making sure they get paid immediately. But on the consumer side, it's an Expedia environment where they can search for medical procedures, compare cost, they can schedule online, and they have to prepay on our site to book the appointment.
Very interesting. Are you, PK, this is Doug.
Hey, Doug.
Are you focused on one specifically geographic segment right now?
So we are currently active in Chicago,
okay,
and we're launching New York in the next month.
Right.
Now, if you look at your niche in the marketplace, PK, what is the problem that you all are looking to solve in this healthcare space?
So we target the consumers who are either on a high deductible, but more importantly, paying out of pocket for medical expenses. Mm-hmm. And what we wanted to bring them is a consumer environment where they can understand what they are paying for, be able to compare cost of procedures, and more importantly, have the same convenience and control as any consumer environment, like an Expedia or an Amazon. Mm-hmm. But and that's a big problem and a big demographic. On the provider side was where we really wanted to innovate. I mean, our biggest innovation is understanding or reinventing the payment process. Mm-hmm. Because when consumers are moving towards high deductible, that puts a lot of pressure on the provider side as well. It causes huge collection challenges because it is more expensive to collect from consumers than from payers.
So you've created these networks, let's say in Chicago. So you've negotiated you've created this provider network that is agreeing to the direct pay relationship. That's one of your first steps, correct?
That's right.
And then you're kind of a hybrid. You're also kind of a transparency, health. You're a buying tool, right? I mean, you're actually helping them select which provider there provides the best cost, quality, and access for them, correct?
That is right.
So it's not just direct pay, it's accessibility to the right players, which comes back to your Expedia analogy. Very good. When did you roll out in Chicago, PK?
So we launched in December in Chicago. Mm-hmm. And we launched with imaging labs and a few other ancillary services.
Now, PK, from your transparency standpoint, what makes you guys different from, let's say, the cast lights, the other players out there that have the transparency piece?
So our mission is actually to drive market-based pricing in healthcare. And if you look at any efficient marketplace out there, one of the biggest hallmarks of that system is payment transparency. Mm-hmm. Cost transparency deals with helping consumers understand what things cost, but we want to bring providers to the table as well. Mm-hmm. And that's what our platform facilitates. It helps providers by offering them payment guarantees, and that helps them to offer a good deal to the patient.
Now, PK, when you're in your discussion with the providers, are they leaning forward to this more than ever?
Oh, absolutely.
Right now? Yeah.
They don't want They don't want that third party waiting period time, do they?
No, they don't, and that's in a consumer-driven health plan. That equation is changing at a very fast pace. Yep. Because now the largest payer is not your insurance company; it's actually the patient. Yep. The insurance company only tells you what you can bill the patient, and contracts on fees. But they're still collecting from the patients. They're more than happy to just exclude them for the relationship. I mean, if you look at the different trends in the market, direct primary care and just cash pay marketplaces, imaging centers, outpatient surgery centers, they're all offering direct pay prices now.
Mm-hmm. Now, if you look at the providers out there, how aggressively are they pricing, whether it be procedures, or how aggressively are they trying to compete against others out there to win the business?
They are. They are more than happy to do that, but more importantly, when we negotiate or talk to them, we actually don't try to negotiate a certain price point. We give them the ability to publish their fees and the ability to change it as often as they want.
Yeah, I was just going to ask you that. So they have the flexibility.
Because it's not only about cost.
Uh-huh. So they can change it. They can change it as they see the market change in front of them.
Absolutely. If the next week is running slow, they reduce the prices.
Yep.
They have the ability to do that.
That's good. What are some of the unique challenges and learning curves your consumers are going through right now?
So one of the biggest things our consumers need to learn is now they are in control of the dollar, and they have to pay upfront to get the best deal, because this is the biggest change that is happening on the consumer side, because they have always been used to just paying a copay, and that's the extent of their financial contribution. Mm-hmm. But on a high deductible, they are responsible for the full dollar amount.
Yep.
And so a big question that we get all the time is, why do I need to pay upfront? Well, that's the only way you get what we offer you.
Mm-hmm.
Now, can this work? Let's say I don't have a high deductible type plan. Would it make sense for me to even utilize your solution?
So, if you have a regular Cadillac plan, PPO, or an HMO?
Yeah, if I have a plan like that, can I still access your products, or would it make your solution, or would it make sense to me to do that?
That would be a decision you need to make if you want to pay up front, but if you have a plan like that, in most cases your plan is paying for all the expenses. So chances are you really don't care what it costs.
So PK, you can work with, or do you work with health plans and their employers
We do.
In conjunction? Okay.
We do, and what we offer them is not a replacement of their existing network, but more an add-on to help consumers use their out-of-pocket more efficiently. Mm-hmm. Because this is the money they are paying for. On our platform, they can compare cost, they can review quality information of the provider, and decide if this is the right facility they want to go to.
Right. Now, are there any unique partnerships that you guys are looking at within the industry to partner with any other players out there?
We are looking at network partnerships and payer relationships. That's what we continue to focus on. But even now, regular consumers can come on our site, and which they already are doing. They're coming on our site and booking medical procedures.
Right. Now, you can fit in some of these private exchange environments. They would be good partners for you, correct?
They absolutely are.
Yeah. Are you working with some now?
Yeah, we keep talking to some of them. We have engagements going live in the next few months, and I would love to share if I can.
So Chicago now, New York soon. What are kind of the next 2-3 markets that you want to roll out to?
So after this, we have Florida and Denver on the roadmap. That's what we are looking at right now. But at this point, we want to focus on these two markets. These are the two largest markets in the U.S.
I know you built companies before. Who's behind you right now? What capital is behind what you're doing?
So our company we have 3 founders. There's me.
Mm-hmm.
There's Kevin Hill. He was the EVP sales at Oxford Health, and went on to become the CEO of United Healthcare's Northeast division when they got acquired by United. Mm-hmm. And Sean McNamara, who has already started multiple gaming and financial companies. Mm-hmm. So that's our founding team, and we raised a round of seed capital last year. The company was part of Blueprint Health, which is an accelerator out of New York.
Oh, yeah, that's Blueprint, yeah. I've heard a lot of positive things about Blueprint, so you've come out of that group.
Yes. We were part of the second batch at Blueprint a year and a half ago, and that was an amazing experience.
Very, very positive, amazing experience, right?
It was. It helped us understand what the challenges we might face as we go live. When we were at Blueprint, we were still basically an idea at that point, and Blueprint helped make connections. We raised our first capital through the connections we made from there. Mm-hmm. So, yeah, Blueprint was an amazing experience, and just the access to so many different thought leaders in one place. That was the biggest advantage we had.
Now, PK, we got about a minute left on the program. Want to make sure kind of leave our audience with a couple takeaways on why they need to look at your solution, and let them know how they can find you.
So they can find us on our website, symbiosishealth.com, right now as well. And what we want to leave them is the market is changing and consumers want more and more control over their healthcare and dollars. And on the same side, same token, providers need more transparency as well. If you're creating a marketplace, which we are, is we want to have both suppliers and buyers on the same platform. Mm-hmm. And that's a trend which we'll see accelerate as more and more patients take control of their dollars.
And so
that's the solution we are offering.
And so currently the offering is Chicago and New York with the intent to roll out into some other markets later on down the road.
Yes.
Yep. We really appreciate having you on the program, PK, and to our audience, as we mentioned early on, if you haven't signed up for IHC Forum here in Atlanta on May 7th through 9th, we do encourage you to do that. You can learn from all the unique solution providers at the event. PK, have a great weekend. And we'll hope to maybe see you at IHC Forum here in Atlanta. To the rest of our audience, stay tuned. Or actually, not stay tuned. See you next. See you next week
so
for you bet. See you next week for Healthcare Consumerism Radio.